Are you struggling with wrist pain that just won't go away? Whether it's from typing, lifting, or even an old injury, wrist pain can make simple tasks like holding a cup of coffee or using your phone unbearable. But how do you know if it's serious? Today, I'll break it all down for you. Hello, this is Dr. Siddharth Amber from Chicago Arthritis and Regenerative Medicine. I specialize in non-surgical treatments for musculoskeletal conditions, rheumatology, regenerative medicine, and metabolic health. My mission is to help you live pain-free and optimize your health with cutting-edge treatments at work. Wrist pain is one of the most common complaints I see in my clinic. It can happen for many reasons, such as repetitive use, injuries, arthritis, or even nerve issues. Some wrist pain is mild and temporary, while other cases can be a sign of something more serious. Today, I'll break down the most common cause of wrist pain, how to recognize symptoms, and most importantly, when you should seek medical attention. Let's dive in. Let's talk about common causes of wrist pain. Repetitive strain injuries are one of the biggest causes of wrist pain today. If you spend hours typing, texting, or using a mouse, you might develop a repetitive stress injury. This happens when small, repetitive movements strain the wrist tendons, ligaments, and nerves over time. Two of the most common repetitive stress injuries include carpal tunnel syndrome, where the median nerve gets compressed at your wrist, leading to numbness, tingling, and pain in the hand, and de Quervain's tendonitis, where you get pain on the thumb side of the wrist due to repetitive gripping or lifting. Quick tip, if you're experiencing tingling or wrist fatigue, take breaks every 30 to 60 minutes, stretch your fingers and wrists regularly to relieve the tension. One of the most common wrist injuries is a sprain, which happens when ligaments stretch too much or tear. This can happen even after a fall, when you instinctively put your hands out to catch yourself. So how do you tell and differentiate a sprain from a fracture? A sprain usually causes swelling, bruising, and pain, but you can still move your wrist. A fracture, on the other hand, causes severe pain, sometimes a visible deformity, and you may not be able to move the wrist at all. If you suspect a fracture, don't wait, get an x-ray as soon as possible to confirm. Arthritis can also cause chronic wrist pain and stiffness. There are two main types of arthritis that affect the wrist. Osteoarthritis, caused by wear and tear over time, leading to cartilage breakdown, is one type, and then there's inflammatory arthritis, an autoimmune condition where the body attacks its own joints, causing inflammation and pain. A key sign of inflammatory arthritis is stiffness that lasts longer than 60 minutes in the morning or after periods of rest. If that sounds like you should get evaluated. Nerve-related wrist pain can also occur. Carpal tunnel syndrome is one of the most common and well-known causes of wrist pain. The median nerve, which runs through a narrow tunnel in your wrist, can get compressed, leading to pains at the wrist as well as into the hand, also numbness and tingling in the thumb and the first three fingers. In more chronic or severe cases, that can then lead to weakness in grip strength, making it harder to hold objects, and pain that wakes you up at night, especially if you sleep with your wrist bent. Sleeping with a wrist brace can help. Also, avoiding keeping your wrist bent for too long during periods while working is also helpful. If you feel wrist pain when lifting something or gripping an object, tendonitis could be the culprit. This happens when the wrist tendons become inflamed due to overuse or improper technique. Proper wrist support during activities and stretching can help prevent tendonitis. So when should you see a doctor? Not all wrist pain requires a doctor's visit, but you should seek medical attention if the following presents. If you have pain that's lasting longer than 2 weeks despite rest and home treatments. If you have numbness, tingling, or weakness in your hand. Or if your wrist is swollen, deformed, or bruised after an injury. Ignoring wrist pain can lead to long-term damage. A focused, quick, and knowledgeable evaluation can help diagnose what your problem is and prevent bigger problems long-term. Let's discuss some at-home treatments that you can utilize for wrist pain. For mild wrist pain, try these simple treatments. Rest in ice. Reduce swelling by icing your wrist for 15 to 20 minutes at a time. Wrist bracing. If you keep your wrist in a neutral position, especially at night, that may help with tendinitis as well as with carpal tunnel syndrome. Stretching and strengthening. Gentle wrist stretching can improve mobility as well. Anti-inflammatory diet. Eating foods rich in omega-3s like salmon and walnuts may help to reduce inflammation. If pain persists or is worsening despite conservative treatment, get evaluated by your physician. Wrist pain is common, but understanding the cause is key to finding the right treatment. Whether it's from overuse, arthritis, or nerve issues, early intervention can help you stay pain-free. If you found this video helpful, give us a like and subscribe for more expert insights on pain relief. For personalized care, visit chicagoarthritis.com and book a consultation. Until we connect again, stay active, stay pain-free, and live well.